Have you been online looking for different tinnitus solutions and seen advertisements for different herbal medicines and herbal supplements for tinnitus? My name is Dr. Ben Thompson. I'm the founder of TrebleHealth.com. I'm making this video because it is one of the most requested videos from our YouTube community. Are there any benefit to herbal supplements for tinnitus? I will break down 5 of the most popular, or at least most highly advertised, herbal medicines or herbal supplements, and I'm going to break down their ingredients, if they have any science to back them up, and whether or not I would recommend them in certain cases. Welcome to my YouTube channel. If you're not already, please find that red subscribe button. It's somewhere down there below the video. I have fun making videos that help educate you and make tinnitus management easier. This video will cover Tinnitus 911, Lipo-flavonoid, Arch's Tinnitus Formula, Synapse XT Pro, and Tindisil. And as a special treat at the end of the video, I will discuss magnesium and Ginkgo biloba and whether they have any scientific validity. If you like this video topic, please underneath this video, find that thumbs up button. That is telling me, yes, I like this video topic. I want to learn more. Consider it like a little thank you. Now, before I dive into this, I need to say, I am not a medical doctor. I am not a nutritionist, a registered dietitian, and I'm not a functional medicine doctor either. I'm an audiologist, which I feel is the best professional to manage the overall tinnitus recovery, tinnitus management process. And because of that, I wanted to comment on whether these herbal supplements, whether these pills are any good. You may be surprised that I even bought these, and quite honestly, it was hard for me to press purchase when I bought these, but I wanted to show you that I'm really looking into these and I'm doing my best to understand if they have any validity or not. First up, we're going to cover Tinnitus 911, which is a horrible name. I'm going to review the ingredients list, so let's read this together. We have vitamin C, niacin, vitamin B6, folic acid, vitamin B12, leaf and flower, garlic, olive leaf, hibiscus flower, another couple of leaves, juniper berry, and green tea leaf. Looking at their labeling, I see claims that it will help relieve tinnitus symptoms, reduces ear noise sensitivity, anti-ringing and buzzing, and improves cognitive function. This shows how there's a lot of false advertising and over-promising in this herbal supplement space. And why is that? Well, the FDA considers this product a food, and the FDA does not regulate or monitor how people market or advertise food products in this sense. So there does not need to be any scientific backing or any study that has been approved by the FDA for pills like this to be sold. I looked into the studies available for the different ingredients in here, and the only one that was even studied specifically was niacin, and that had little to no scientific evidence to reduce tinnitus. Of course, the other compounds in this pill, they are natural, so we hope. We can't actually understand what is inside of each pill, but we have to rely on at least the ingredients that they listed. The other vitamins, herbs, leaves, tea leaves, etc., those are probably good for your health. Those are probably good for your overall health. So indirectly, that may help manage tinnitus, because when the brain, the mind, the body, when it's all healthy and operating at the best level, then it gives the body the best chance to naturally reduce the perception and the loudness of tinnitus. So that's plausible that those things could indirectly help. But for most people, if you're eating a balanced diet, you don't need to take a supplement for tinnitus. Overall, my rating for Tinnitus 911 is poor. I would never recommend it, and it has little to no scientific evidence to support it. Next up, we have Lipoflavinoids. I'm going to read the ingredients of Lipoflavinoids for tinnitus. Vitamin C, vitamin B, niacin, vitamin B, calcium, and the bioflavonoid complex. The marketing for lipoflavonoids says that it is the most recommended herbal supplement by ENT doctors. I find that very hard to believe and false. And if I asked 10 doctors, do you recommend lipoflavonoids to your patients? Most would say, no, I don't. Now for the scientific evidence. According to the American Tinnitus Association, Lipoflavinoid Plus was studied scientifically, and the results were that it was not effective in reducing tinnitus. That's the only scientific study that I found. Therefore, my rating for lipoflavonoids is poor, not recommended, not likely to reduce tinnitus. Next up is Arch's Tinnitus Formula. Let's read the ingredients. It has zinc, garlic, and Ginkgo biloba, a proprietary leaf extract, concentrated Ginkgo leaves, and some other compounds. If you have tried this, I'm sorry because it probably hasn't worked for you. If it was recommended to you by a doctor or a health professional, then it's probably irresponsible. Let's try to find if Ginkgo biloba has any scientific backing and if there's any literature or double-blind studies about Ginkgo biloba. There was a review paper published in 2017 called Ginkgo biloba and the Treatment of Tinnitus, an updated literature review. This was published in the International Tinnitus Journal. They reviewed a number of studies that looked at Ginkgo biloba, and let's read what they found. Most findings are in contrast with each other, so that some of the studies reported that Ginkgo biloba is effective in the treatment of tinnitus, and other studies referred to it as an ineffective herbal medicine. Generally, according to the previous studies and the present study, it can mention that the Ginkgo biloba may somewhat improve tinnitus. Since tinnitus is multifactorial, it's recommended to evaluate patients individually based on the cause of tinnitus and recommend the appropriate management strategies. Overall, the research is inconsistent on Ginkgo biloba for tinnitus. I don't recommend this. I actually find that using any sort of pill for tinnitus can be a distraction and psychologically make us feel like this should be a quick fix, when in reality, we need to be committed and put in place a real management strategy day by day to naturally manage this through cognitive tools, sound therapy, and oftentimes professional counseling. That said, if any of these herbal supplements are working for you, then that's great. Please keep using them. If something's working for your tinnitus, then I encourage you to keep doing it. Now, there are some caveats. There could be some red flags. There could be some reasons not to do something. But if you're finding benefit from anything, then who am I to tell you to stop that, right? My review of the Arches Tinnitus Formula is poor. I do not recommend it to tinnitus patients, and there's little scientific evidence to support it. For Ginkgo biloba specifically, there's mild, inconsistent scientific reports that it could help some patients. Nevertheless, all the people that I see getting better with tinnitus are not using any of these herbal supplements. Next on this list, we have Synapse XT Pro. I almost feel nasty holding this in my hands. That's how much I dislike it. That said, I'll try to be as independent on this report as possible. Let's read the ingredients. Turmeric root, other kinds of roots, a fruit extract, apple cider vinegar, black pepper, green tea extract, psyllium husk, aloe vera, coffee bean, magnesium, calcium, raspberry, ginger, acai berry, ginseng, dandelion root, cinnamon, garlic, and something I can't pronounce. Probably heard about this one because they have a very aggressive group of affiliate marketers. That means they're paying people to sell their product online. So you've probably seen advertisements for this all over the internet. This is not created by a group of reputable scientists, and the claims for tinnitus are not strongly backed in science. As you heard from the ingredients, there's nothing wild or crazy in there. For someone who eats a balanced, healthy diet, then you should get most of these compounds in your everyday or weekly diet. Therefore, these nutrients, these herbal supplements are not going to really change your tinnitus. Sure, if you're eating healthy, because a lot of the ingredients here are good for your health, right? Low inflammation, feeling good, that could make it easier for your brain to habituate or reduce the tinnitus perception. But scientifically, what do we have to say that this does anything independently? There have been no studies about Synapse XT Pro and if it can reduce tinnitus. Sure, some of the individual ingredients could be good for your health and that may help. Overall, my review of Synapse XT Pro is poor. I do not recommend it. You do not need it to get better with tinnitus. Please save your money and do not buy Synapse XT Pro for tinnitus. And finally on this list, we have Tindisil. Let's read the ingredients here together. It has vitamin A, vitamin C, vitamin E, vitamin B6, folate, vitamin B12, magnesium, zinc, lipic acid, and ginkgo biloba, as well as the bioflavonoid complex. This is kind of like a mix of all the different ones we talked about, isn't it? There's no science to support Tindisil either. I give it a thumbs down, a poor rating. I've seen no evidence to show that it can help reduce tinnitus. How about magnesium? Magnesium could actually be something that's beneficial and has pretty low risk. Let's ask Dr. Jamie, who we interviewed on my YouTube channel, about their thoughts on magnesium. Jamie is a medical doctor in California and gave her opinion on the benefits of magnesium for sleep, brain health, and potentially tinnitus.
I would say overall in general, whether we're talking about over-the-counter cough and cold medicine or vitamins, I tend to recommend people focus on single ingredients rather than combinations. Because when you get combinations, you don't really know what's in it. And often you get suboptimal doses of lots of things. And then you also are not going to know which of those things is the thing that benefits you. So that generally is my bias. In terms of overall health, most people who have resources financially and otherwise to eat a well-balanced diet, I am not generally someone that recommends a multivitamin. I much prefer that people get their nutrients from food. And so I actually am a big fan of magnesium. I think it's a wonderful mineral that, unless you are on medications or have a condition that your doctor says you shouldn't take it, is generally something I think that is well tolerated and has a whole host of benefit.
From all that we've learned today, it seems like magnesium may be the only thing worth considering. Ask your doctor if that's right for you. I am not promoting magnesium, just saying from my research that has potential promise, whereas all the other all-in-one tinnitus pill solutions, I'm not recommending. I frankly don't believe you need them and would love for you to concentrate your time and energy on getting better with tinnitus with natural methods, with tinnitus retraining therapy, with sound therapy, with professional support. You can do this. You can get better with tinnitus. I've seen it all the time. There's a lot of negative information online, and a lot of these tinnitus pills are fueling that story in our mind that this is the worst thing. We need to fix this right away. This is going to be a quick fix. I'm going to get out of this. Just take a breath. Just exhale, because you can manage this condition. And that's what audiologists like myself have been well trained to do. I want you to remember there is a natural habituation period, a period where naturally over time, if the mind, brain, and body are in a good state, then tinnitus can reduce. You'll hear it less and less, and eventually your brain automatically tunes it out so that you're hearing it infrequently during your day. Often when that happens, the sound can get softer too. So you may have seen some anecdotal reports that these herbal medicines for tinnitus have worked, but it's hard for us to independently analyze that when over a period of time, there is some form of natural habituation as well. Whatever works, we want to try. We only recommend things that are working for most of our patients. My name is Dr. Ben Thompson. I'm an audiologist and founder of TrebleHealth.com. Thank you for being here on my YouTube channel. If you enjoyed this video, then make sure you are subscribed to my YouTube channel, where there's many more just like it. If you're in need of expert guidance from an audiologist on how to manage tinnitus, or simply asking some questions about hearing aids, hearing loss, tinnitus management, please reach out to our team. You can find us at TrebleHealth.com. I really appreciate you being here, and now I'm excited to return these pills to Amazon, where I bought them from, so that I can wipe them off of my conscience that I'm not contributing money to any of these companies, and I can go to sleep peacefully at night, knowing that I'm hopefully helping you who's watching, who can get on the right track with tinnitus and not waste your money on different pills that promise but don't deliver.
Hi, I'm Mike. I'm working with Dr. Ben, and I had pretty severe tinnitus about 2 months ago, and it's gotten somewhat better. I think what contributed to my anxiety at the time was, going online and looking at all these supplements and doing various exercises to help with the tinnitus, which really didn't help me any. It actually, I think, hurt in some ways, because there was a lot of expectations that I would be getting better. And in fact, I think it just helped me focus more on the tinnitus. So some of the things that I tried was the Lipoflavinoid and the melatonin and the magnesium. And with trying all that, the expectation was pretty high in my own mind that it would actually get better. It turns out that it just, as I said, it just helped me focus more on the tinnitus and bring it forward in my mind. If you look at the research, none of those things are really proven that there's a direct link. And logically you say that, but when you're desperate, you want to try anything that might help. But I think that in many ways it just hurts. So that was my experience with those supplements.
On the side here, you'll see another video I made, which covers my top tips for tinnitus sound therapy. If you're new to tinnitus and wondering how to use sound therapy, then I would start there. So click that video on my side. Thank you so much. Take care.